My name is Jessica Cohan. I'm an associate professor in the Department of Surgery at the University of Utah and the Huntsman Cancer Institute. My clinical practice is in colorectal surgery. We know that hundreds of thousands of older adults undergo major surgery every year, and this number will only increase with time. These older adults are our parents, partners, friends, and family members. We also know that our loved ones face serious risks after surgery. For some, recovery after surgery involves a slowing or impairment in thinking or movement, like someone who now struggles to balance their checkbook, or someone who used to love to garden but no longer has the energy. These changes after surgery can be temporary or long lasting. Some are never able to return to their normal life after surgery. I'm passionate about improving surgical care for older adults. My work extends through the entire spectrum of surgical care, from before surgery to the end of the recovery process. One of the most critical moments in surgical care is the moment we make a decision about whether or not we should actually do surgery. Research shows that in most cases, surgeons make a decision based on whether surgery can be done, but less attention is given to how surgery is expected to help the patient in their life. In other words, we struggle to discuss the goal for surgery. Is it to remove a cancer to help somebody live longer, or to unblock an artery to help somebody walk farther? This information is needed if surgeons, older adults, and their families are to make a decision about whether going through surgery is actually worth it. This is so important that multiple quality initiatives have been developed that require a discussion of patient goals. However, discussing goals during surgical consultations has proven much harder than you would think. This specific project is part of a study funded by the National Institute on Aging, where we are trying to change the culture of surgical consultations. We are working with older adults, families, and clinicians to make sure that if an older adult is undergoing surgery, that it makes sense in the context of that patient's goals and what matters most to them. We are developing a conversation guide that makes it easy to discuss these goals in everyday surgical consultations. We are changing the culture of surgical consultations, creating a way that makes it easy to discuss goals. We're incorporating ways that these goals can be documented to improve a person's care from the entire team as they go through their surgical care from start to finish. This voucher funded our work with the Community Collaboration and Engagement Team, which helped us to recruit older adults and their caregivers to focus groups. We were able to conduct a total of 4 focus groups, including one in Spanish, so that these patient and caregiver voices would be incorporated into the design of the conversation guide. As a result of the voucher, we were able to apply some research funds to get professional assistance with the design of the conversation guide. And we were also able to do more in-depth work with patients and their families during real-life surgical consultations, modifying the conversation guide in real time. I would highly recommend that you apply for a CTSI voucher. It's so easy to do the application and can be incredibly beneficial, especially as research budgets are tightening every year.